the opioid epidemic now. New CDC numbers show overdose deaths declined in the U.S. for the first time in nearly 3 decades last year to about 69,000 deaths.
That includes 314 Rhode Islanders. While there are initiatives statewide to combat the crisis, leaders say more work needs to be done.
It's why more than $360,000 was awarded to Kent and South County prevention coalitions. Eyewitness News reporter Alexandra Leslie has the details that are new at 5:30.
Today, 15 different organizations throughout Kent and South counties are on their way to helping combat the opioid crisis thanks to new state funding.
My name is Mike, and I'm a person in long-term recovery.
Mike Fry hasn't used drugs or alcohol since 2012. For him, he says prison was what set him on the path to becoming clean. He says when he was younger, there weren't many options to get help.
I was one of those at-risk teens. Maybe if I had more awareness, maybe if I had more heard about prevention in summer camp or in an after-school program.
Wednesday, Kent and South County prevention coalitions announced how they hope to give programs like those opportunities to help kids like Mike.
SOAR funding was awarded through a competitive bidding process to fund innovative community initiatives and activities to reduce opioid use and overdose and support those impacted by this crisis.
For example, the Boys and Girls Clubs of Warwick will use its money to hire a full-time licensed social worker.
To develop prevention support programming, train staff in emotional intelligence, work one-on-one with at-risk youth, and promote social emotional learning within the organization.
The State Opioid Response funds were awarded by the State Department of Behavioral Health Care, Developmental Disabilities, and Hospitals. The hope is each award will carry out prevention priorities in each community.
This is not a state-solved problem. There's nothing that we at the state are going to do alone that is going to make a difference. The difference is here. The difference is in this room. The difference is with all of you.
To find out more about how each recipient will benefit, I have more in-depth coverage on this story on WPRI.com. I'm Alexandra Leslie, Eyewitness News.